Good evening, beautiful people. Thank you so much for joining us this evening. Hope you're having a fantastic day and week, and whatever you make of this season that's upon us. Welcome to our live weekly YouTube readings of the final report of the California Reparations Task Force right here on the CJEC YouTube channel. This is the only live reading of the California Reparations Task Force final report on YouTube. The final report of the first in the nation California Reparations Task Force is one of, if not the, most important government reports about the Black American community since the 1960s. Equally important is also the foundation for current and future reparations legislation in California. The report is nearly 1,100 pages long, and we're bringing you every page of it, chapter by chapter, every week on Thursdays at 7 p.m. Pacific Standard Time so that you are properly educated in your advocacy for reparations in California. Today's reading of the final report is presented to you as a community service with support from the Reparations Organizing and Mobilizing Team at the Coalition for Just and Equitable California, CJEC. CJEC is California's leading grassroots organization born for reparations and reparative justice for Black American freedmen living in California. For more info on CJEC and our work helping to enact the law that created the California Reparations Task Force, California's law requiring state agencies to collect data on descendants of U.S. slavery, the Act to End Current Slavery in California state prisons, the California Freedmen Affairs Bill, and more, visit www.cjec-official.org. Before we go any further, right now, I need you to do 3 things. First, like this video. Second, hit the bell for reminders. Lastly, subscribe to our YouTube channel. And after we're done reading tonight, I'll need you to do 3 more things. Get connected. Follow CJEC on all social media, Instagram, TikTok, Facebook, and X, formerly known as Twitter, as CJEC Official. Get informed. Visit cjec-official.org and sign up for our current and accurate California reparations news and info on our Get Involved page. And then get involved. Support our work by volunteering and or donating. To donate, just click the Donate tab on the homepage of our website. Special thanks to our amazing fiscal sponsor, the California Black Women's Health Project. You can find more information about them at www.cabwhp.org. By way of introduction, my name is Carol Toliver. I live in San Lorenzo, California. I'm originally from a small town in upstate New York called Ossining, New York. And I'm a volunteer reparations advocate with CJEC's Reparations Organizing and Mobilizing Team. The agenda for today, Chapter 20 of the final report of the California Reparations Task Force, Part 2. The title of the chapter we're reading tonight is Policies Addressing Racial Terror. You can follow along in the reading, download tonight's chapter, or the full final report yourself by going to our website, www.cjec-official.org/reports. Okay, we are about ready to start our reading. But before we do, I have some special thanks and announcements to make. First, as always, I'd like to thank our good friends at ETM Media Group on YouTube for their live readings of the first California Reparations Report. You can watch their readings of the first report on their channel at ETM Media Group on YouTube and on our website at cjec-official.org/videos. Second, for those of you who don't know, historic reparations legislation in California is here and more is coming. SB 490 is California's first lineage-based reparations-related legislation to establish the California American Freedmen Affairs Agency. The bill was introduced by State Senator Stephen Bradford and will move forward in 2024. That's only a month away, y'all. To read the entire bill, visit cjec-official.org/advocacy. Third, as mentioned, more historic reparation bills are coming over the next several months. More reparation bills will be written. During the 2024 legislative session, we'll see those bills introduced and start moving toward passage by majorities of both the California State Assembly and Senate. To pass reparation bills in 2024, we need 41 Assembly members and 21 senators to say yes. And when those bills are passed, we need our governor to sign the bills. So, to make reparations a reality in California, the math is 41 plus 21 plus 1. That is 41 Assembly members, 21 senators, and 1 governor. 41 plus 21 and 1 equal reparations in California. Lastly, but not least, special thanks to CJEC's reparations organizing and mobilizing team, specifically our volunteer final report readers. So without further ado, Chapter 20, Part 2 of the California Reparations Task Force Final Report. My reading will begin on page 680, the first full paragraph. Despite the significant levels of harassment and discrimination African American LGBTQ+ students experience because of their LGBTQ+ status and race, these students have few resources available to them. When they complain to teachers and school personnel about being assaulted or harassed, the response is often for the students to just, quote, ignore it, end quote. Less than half of the African American LGBTQ+ students who responded to a 2017 school climate survey reported having a supportive school administration. Although there is evidence that gay-straight alliances allow LGBTQ+ students to feel more connected to their schools and improve the overall climate of a school for LGBTQ+ students, LGBTQ+ students at majority African American schools are less likely to have access to a gay-straight alliance. The lack of supportive resources in majority African American schools may be due in part to a lack of funding, as African American schools have disproportionately low levels of funding compared to majority white schools. LGBTQ+ students who experienced an unsupportive and unsafe school environment, one in which they experienced both homophobic and racist harassment, had poorer academic outcomes and decreased psychological well-being. These negative effects reverberate beyond high school. African American LGBTQ+ students are less likely to pursue college or other post-secondary education, and many experience greater levels of depression. In a recent study, 63% of African American LGBTQ+ youth reported experiencing symptoms of major depression. 55% reported symptoms of generalized anxiety disorder in the past 2 weeks. In the same study, 44% of African American LGBTQ plus youth and 59% of African American transgender and non binary youth reported that they considered suicide in the previous 12 months. A separate study found that 25% of African American transgender or non binary youth reported attempting suicide sometime within the last year. And although a key factor in suicide prevention is social support from family members, African American transgender and non binary youths were, quote, far less likely than their Black, lesbian, gay, bi, and queer peers to receive it, end quote. Despite this urgent crisis, African American youth are less likely than white youth to receive outpatient mental health treatment, even after a suicide attempt. A recent survey reported that 60% of African American LGBTQ plus youth who wanted mental health care in the previous year did not receive it. Of these youth, more than half cited affordability as a barrier to mental health care. Over 40% of African American LGBTQ plus youth who did not receive mental health care cited concerns around parental permission. African American, transgender, and non binary youth cited concerns with finding an LGBTQ plus competent provider and previous negative experiences with the providers as reason for not obtaining care. Other reasons African American LGBTQ plus youth did not access mental health care included issues related to trust, fear, and ineffectiveness of potential treatment. To address the issues facing African American LGBTQ plus youth in education and mental health, the task force recommends that the legislature enact the following legislation. First, the task force recommends that the legislature enact legislation to require the Department of Education to develop an effective anti-bullying and anti-harassment model policy for all ages and grade levels that is anti-racist and LGBTQ plus inclusive. The policy should specifically include language that addresses race, ethnicity, sexual orientation, perceived sexual orientation, gender, gender identity, and gender expression. It is further recommended that the legislature require the Department of Education to develop an evidence-based model policy for all ages and grade levels to address physical bullying and social bullying. The legislation also should require all local school agencies and school districts in California to adopt and implement the model policies developed by the Department of Education and provide reimbursement for costs associated with implementing the policies. The task force recommends that the legislature enact legislation requiring all public school personnel, staff, and administrators statewide to receive training and support to increase cultural humility and cultural sensitivity around the treatment of all African American students, including those perceived to be LGBTQ+, as well as African American personnel and staff who identify as LGBTQ+. The training should focus on the specific health and safety of each subgroup within the LGBTQ plus community and intersecting identities, including African American LGBTQ plus students. The task force also recommends that the legislature enact legislation requiring public school districts to approve and fund a gay-straight alliance at every school within a district where at least one student requests permission to start one. Because of the significant positive impact the presence of a gay-straight alliance has on the overall school environment, the legislation should specifically prohibit local school districts and public schools from denying a student's request to start a gay-straight alliance at their school. To increase school connectedness and address depression, the task force also recommends that the legislature enact legislation to fund peer to peer group programs and healing circles within public schools throughout California for African American LGBTQ youth. To address the mental health crisis that is currently facing African American LGBTQ youth, the task force recommends that the legislature pass a resolution stating that African American transgender and non binary youth suicide is a public health crisis and enact legislation to fund statewide research on the issue of suicide risk and prevention in LGBTQ youth, including African American transgender and African American non binary youth. The task force recommends that the legislation funding the research also require that the Office of Health Equity within the California Department of Health collect data on suicide in African American LGBTQ youth in California. The legislation should also provide funding to support a public media campaign to disseminate the data the Office of Health Equity collects and the results of the research conducted. These measures are needed to educate African American communities and the larger public on protective factors shown to lower the risk of suicide for African American LGBTQ youth. The task force recommends that the legislature enact legislation requiring all public school personnel, staff, and administrators statewide to receive training and support to increase cultural humility and cultural sensitivity around the treatment of all African American students, including those perceived to be LGBTQ, as well as African American personnel and staff who identify as LGBTQ. The training should focus on the specific health and safety of each subgroup within the LGBTQ community and intersecting identities, including African American LGBTQ students. The task force also recommends that the legislature enact legislation requiring public school districts to approve and fund a gay-straight alliance at every school within a district where at least one student requests permission to start one. Because of the significant positive impact the presence of a gay-straight alliance has on the overall school environment, the legislation should specifically prohibit local school districts and public schools from denying a student's request to start a gay-straight alliance at their school. To increase school connectedness and address depression, the task force also recommends that the legislature enact legislation to fund peer-to-peer group programs and healing circles within public schools throughout California for African American LGBTQ youth. To address the mental health crisis that is currently facing African American LGBTQ youth, the task force recommends that the legislature pass a resolution stating that the African American transgender and non binary youth suicide is a public health crisis and enact legislation to fund statewide research on the issue of suicide risk and prevention in LGBTQ youth, including African American transgender and African American non binary youth. The task force recommends that the legislation funding the research also require that the Office of Health Equity within the California Department of Health collect data on suicide in African American LGBTQ youth in California. The legislation should also provide funding to support a public media campaign to disseminate the data the Office of Health Equity collects and the results of the research conducted. These measures are needed to educate African American communities and the larger public on protective factors shown to lower the risk of suicide for African American LGBTQ youth. The task force also recommends that the legislature fund public health and education campaigns that employ voices trusted by African American LGBTQ plus youth to promote mental health wellness and provide information on accessing mental health care within the African American community, including schools, churches, and other spaces where African American LGBTQ plus youth gather. To address disparities in mental health for African American LGBTQ plus youth, the task force recommends that the legislature enact legislation to increase funding to expand publicly funded mental health treatment programs for African American LGBTQ plus youth. In addition, funding should be provided for CBOs that provide mental health treatment services for African American LGBTQ plus youth. Funding should also be directed to fund the collection of demographic data by publicly funded mental health treatment programs and CBOs for the population served, disaggregated by age, race, gender, and sexual orientation. A significant number of African American LGBTQ plus youth who want to access confidential mental health care without a parent's permission are unable to do so. Therefore, the task force recommends that the legislature enact legislation that will allow mental health providers to treat African American LGBTQ plus youth who are under age 18 and may otherwise not receive care because parental permission is required. African American LGBTQ plus youth also encounter barriers to accessing mental health care when they are unable to find an African American mental health provider or a provider who specializes in working with African American LGBTQ plus youth. The task force therefore recommends that the legislature create and fund recruitment programs in California that recruit diverse candidates for master's and doctoral level psychology programs and professional counselor and therapist training programs committed to serving African American LGBTQ plus youth and adults, especially those who reside in African American communities and in other communities where significant numbers of African Americans reside. The task force also recommends that the legislature require and fund cultural humility and anti racist training for all candidates in these programs. That training should include, at a minimum, training protocols on interrogating a mental health professional's personal biases and understanding how racial and heterosexual bias and oppression causes and exacerbates the mental health concerns that impact African American LGBTQ plus youth and lead that population to seek therapy. The task force further recommends that the legislature include adequate funding for the programs to collect and disseminate data disaggregated by race, gender, age, and sexual orientation of the candidates who were admitted into these programs, successfully matriculated through the programs, and are providing mental health services to African American LGBTQ plus youth after graduating. The task force also recommends that the legislature enact legislation requiring annual competence and cultural sensitivity training that certifies that a mental health professional is qualified to work with culturally diverse populations, specifically African American youth and African American LGBTQ plus youth. African American LGBTQ plus adults. The difficulties African American LGBTQ plus individuals face extend to employment. LGBTQ plus individuals experience high rates of discrimination and harassment in hiring and in the workplace. For example, Studies have shown that employers are less likely to reach out to perceived LGBTQ plus job candidates for interviews. Discrimination is heightened for LGBTQ plus applicants who are African American. 78% of African American LGBTQ plus individuals who responded to a survey conducted by the Center for American Progress in 2020 reported that discrimination affected their ability to be hired. For white LGBTQ plus individuals, that number was 55%. Even when they are hired, racism and heterosexism affects the ability of 56% of African American LGBTQ plus individuals to maintain their jobs. As detailed in Chapter 10, Stolen Labor and Hindered Opportunity, and Chapter 13, The Wealth Gap, the income disparity between African American and white Californians is significant. The income disparity is worse for African American LGBTQ plus adults. Quote, across all the economic indicators, Black LGBTQ adults have a lower economic status than Black non LGBTQ adults. End quote. For example, African American LGBTQ plus adults have higher unemployment rates compared to African Americans who are non LGBTQ plus. 39% of African American LGBTQ plus adults in the United States had a household income of less than $24,000 a year, compared to 33% of non LGBTQ plus African Americans. And more African American women who are LGBTQ plus live in low income households than non LGBTQ plus African American women. Disparities in outcomes for LGBTQ plus African Americans exist in the mental health and healthcare systems as well. Quote, consistent discrimination takes a significant toll on individuals' mental and physical health. Physiologically, harassment and mistreatment have been shown to lead to cortisol dysregulation, which affects a wide range of bodily functions. As a result, African American LGBTQ individuals often experience mental and physical health challenges. End quote. Both African American LGBTQ plus men and women are more likely to have been diagnosed with depression than non LGBTQ plus African American men and women. African American lesbians have a higher rate of suicide than other LGBTQ plus groups, but they are less likely to seek out traditional professional mental health than their white counterparts. Seeking treatment in the mental health and healthcare systems can often cause more harm, however. One barrier to seeking mental health treatment is the concern about being mistreated by mental health providers based on race or sexual orientation. LGBTQ plus individuals can be harmed at every stage in the mental health system, including referral, intake and assessment, and intervention. In one survey, African American LGBTQ plus clients who reported that they were very dissatisfied with the treatment they received most frequently felt their providers fell short in addressing race and ethnicity concerns, trauma, sexual orientation concerns, and grief. Specifically, providers did not know how to help with respondents' sexual orientation concerns or inappropriately focused on their sexual orientation when that was not the reason they sought treatment. Some respondents to the survey also reported that their mental health provider made negative comments about their gender identity or expression. Additional barriers to seeking treatment include mistrust of mental health treatment and lack of resources to pay for treatment. Medical doctors often lack awareness of LGBTQ plus patients' needs as well. This is in large part because more than half of medical school curricula do not provide information about the health issues and treatment of LGBTQ plus patients beyond work related to HIV. This leaves African American LGBTQ individuals facing compounded forms of stigma at the doctor's office and often encountering substandard care, harsh language, and even physical mistreatment. In a recent survey conducted by the Center for American Progress, 15% of African American LGBTQ plus individuals reported some form of negative or discriminatory treatment from a doctor or healthcare provider in the previous year, and 7% reported being refused care entirely. 14% of African American LGBTQ plus individuals reported that in order to receive appropriate care, they had to teach their doctor about their sexual orientation. 11% reported that the doctor who treated them, quote, was visibly uncomfortable, end quote, because of their sexual orientation. To increase the number of medical and mental health providers treating African American LGBTQ plus individuals, the task force recommends that the legislature enact legislation to fund scholarships and loan forgiveness for physicians and mental health professionals who focus on providing services to African American LGBTQ plus individuals through medical clinics, mental health treatment programs, and community-based organizations that provide mental health services in African American communities and in communities where significant numbers of African Americans reside. The task force recommends that the legislature create and fund recruitment programs in California that recruit diverse candidates for master's and doctoral level psychology programs and professional counselor and therapist training programs committed to serving the African American LGBTQ plus community. The task force also recommends that the legislature include funding in the legislation for cultural humility and anti-racist training for all candidates in the program. That training would include, at a minimum, training protocols on interrogating a mental health professional's personal biases and understanding the role racial and heterosexual bias and oppression play in causing and exacerbating the mental health concerns that impact African American LGBTQ plus individuals and may lead them to seek therapy. The task force further recommends that the legislature include adequate funding for the programs to collect and disseminate data disaggregated by race, gender, age, and sexual orientation of the candidates who were admitted into these programs, successfully matriculated through the programs, and are providing mental health services to African American LGBTQ plus individuals. The task force recommends that the legislature enact legislation requiring annual competence and cultural sensitivity training that certifies that a mental health professional is qualified to work with culturally diverse populations, including specifically African American LGBTQ plus populations. One example of a set of practices that would allow practitioners to develop cultural sensitivity skills in working with the African American LGBTQ plus population is the Gay Affirmative Practice Model, which addresses areas of reflection for mental health providers that could help strengthen overall cultural sensitivity in treating members of the African American LGBTQ plus community. To address the discrimination African Americans who are LGBTQ plus face in hiring and retention, which impacts their economic outcomes, the task force recommends that the legislature amend Government Code Section 12999, which requires all employers in California with at least 100 employees to file an annual payee data record with the California Civil Rights Department, formerly the Department of Fair Employment and Housing, showing the number of employees by race, ethnicity, and sex in the job category specified in Government Code Section 12999, Subdivision B. The task force recommends that the legislature amend Section 12999 to require employers in California with at least 100 employees to also report the number of employees by sexual orientation in the category specified in Section 12999, Subdivision B. Employers will provide that information voluntarily, and the employer will be required to collect and store the demographic data separately from employees' personnel records. The task force further recommends that the legislature amend Section 12999 to require employers to also include in their annual payee data record the number of employees advanced or promoted during the reporting period by race, sex, ethnicity, and sexual orientation. The task force further recommends that the legislature amend Section 12999 to require each employer to include in its data payee record the number of unselected job applicants for the categories specified in Section 12999, Subdivision B, by race, ethnicity, sex, and sexual orientation. Job applicants would provide this information voluntarily, and the information would be stored separately from the application. To assist African American LGBTQ plus employees who are terminated from positions, the task force recommends that the legislature enact legislation to provide funding to CBOs that provide free job training services, job counseling, and free continuing education classes to African American LGBTQ plus individuals who were terminated from their positions. It is also recommended that the Employment Development Department include on its provider list job services providers that provide job services and training to African American LGBTQ plus candidates. Implement procedures to address the overdiagnosis of emotional disturbance disorders, including conduct disorder, in African American children. African American children are more likely to be placed in special education classes than white students and are 2 to 3 times more likely than white students to receive a label of emotional disturbance in schools. African American children are also 2.4 times more likely than white children to receive a conduct disorder diagnosis. Historically, the adolescents who have been overdiagnosed with conduct disorder, a subset of emotional disturbance, are, quote, urban, end quote, low income, and African American. Research indicates that white children who exhibit comparable behaviors that would lead to a conduct disorder diagnosis in African American children generally receive diagnosis of mood, anxiety, or developmental disorders, conditions that are deemed more treatable. Research also indicates that teachers and school staff often have referred African American children, males in particular, for assessment for emotional disturbance and special education placements based on a misinterpretation of behaviors that are rooted in cultural differences, such as their posture and how they walk and dress. Restrictive educational placements, like special education classes, quote, socialize Black children for prison and contribute to the school to prison pipeline, end quote. The majority of African American students who receive special education services under a referral of emotional disturbance drop out of school, and 73% of those students are arrested within 5 years of dropping out. Studies suggest that African American children mislabeled with emotional disturbance or misdiagnosed with conduct disorder may be suffering from other conditions. Specifically, quote, many youth may express conduct problems in response to underlying mood or anxiety disorders, end quote. Depression, for example, has been shown to be a precursor to conduct problems. Research also indicates that African American children are often labeled as emotionally disturbed and underdiagnosed with autism spectrum disorder because autism spectrum disorder can be mistaken as bad behavior. A 2007 study found that African American children were 5.1 times more likely to be misdiagnosed with conduct disorder before eventually being diagnosed with autism spectrum disorder. Conduct problems or concerning behaviors may also be responses to environmental stressors. For instance, racial discrimination from teachers and peers predicted conduct problems and low academic performance for African American adolescents. Poor academic achievement also is a significant contributor to conduct problems. Therefore, clinicians evaluating a child for conduct disorder should always consider the child's social context or environment in order to reach an accurate diagnosis. Recognizing the distinction between conduct problems that are a normal response to a negative social environment and those that are the result of internal dysfunction, the textual commentary at the end of the criteria list for conduct disorder in the DSM 5 TR indicates that the diagnosis would be misapplied where a child's conduct problems are a response to environmental stressors, such as living in, quote, very threatening, high crime areas, end quote, and warns that, quote, reactions to racism that involve anger and resistance based coping may be diagnosed as conduct disorder by uninformed practitioners, end quote. To address both the overdiagnosing of behavioral conditions like conduct disorder and the underdiagnosing of other conditions like mood disorders or autism spectrum disorder in African American children, and reduce excessive referrals of African American children to special education, the task force recommends that the legislature amend California's Education Code and California's Code of Regulations, which govern student assessments in conformity with the Individuals with Disabilities Educational Act, IDEA, and is implementing regulations to require clinicians in California to evaluate first whether the behaviors a child is exhibiting are related to environmental stressors, including the child's social context, before assessing a child for emotional disturbance or conduct disorder. Requiring consideration of the impact of environmental stressors on a child's behavior would ensure consistent application of the textual commentary to the diagnosis in the DSM 5 TR and minimize the risk of a conduct disorder misdiagnosis. The task force also recommends that the legislature amend California's Education Code and assessment regulations to require that a clinician evaluate a child for autism spectrum disorder or mood disorders for which early interventions and supports can be critical, and which are less stigmatizing than emotional disturbance or conduct disorder, before categorizing a child as meeting the legal criteria for emotional disturbance or diagnosing a child with conduct disorder. The regulations would require a clinician making a diagnosis or special education referral to certify that assessments for environmental stressors, autism spectrum disorder, or other conditions were completed before the assessment of emotional disturbance or conduct disorder was made. Parents and children will be entitled to appropriate statutory remedies where this step is omitted in initial evaluation. To increase the cultural competence of clinicians who diagnose and treat children, the task force recommends that the legislature enact legislation to require those clinicians to complete continuing education or training on conducting culturally sensitive diagnosis and treatment of conduct problems as part of the state's licensing requirements. Currently, psychologists are required to undertake just 4 hours of training in cultural diversity or social justice. The continuing education requirement recommended here is more specific. The requirement would require culturally sensitive training in diagnosing and treating emotional disturbance disorders in children, including African American children in particular, and would apply to all psychologists, psychiatrists, and other mental health professionals involved in diagnosing and treating children and adolescents. Consistent with the need for additional training for clinicians who work with African American children, the task force recommends that the legislature amend the MHSA to mandate that the Office of Health Equity provide grants to mental health treatment professionals' member organizations to implement training and continuing education programs for their members on how to conduct culturally sensitive diagnosis, including for conduct disorder. The curriculum for the training would impart the need for clinicians to take into account the following considerations to ensure an accurate diagnosis. 1. The clinician's cultural biases. 2. The child client's cultural background. 3. The cultural biases of any diagnostic assessment measures being used. And 4. A careful differentiation of the client's culture and circumstances from a mental disorder. To ensure that the children who are appropriately placed in special education programs benefit from their placements, the task force also recommends that the legislature enact legislation requiring the California Department of Education to revise the special education curriculum to include interventions that have been proven to be effective in helping students assessed as meeting statutory criteria for emotional disturbance benefits from their special education placements. Three interventions that have been proven to be beneficial for children placed in special education programs include: 1. Providing quality teacher feedback, including verbal praise. 2. Allowing flexibility in the completion of academic tasks. And 3. Using behavioral staff as a means of additional academic support. Disrupt the mental health crisis and county jail cycle in African American communities. The overrepresentation of African Americans in the criminal justice system is well established. African Americans are 4.2 times more likely than white people to be incarcerated in jail and nearly 8 times more likely to be incarcerated in prisons in California. People with mental illness are also overrepresented in the criminal justice system. The most recent available data from the Bureau of Justice Statistics shows that more than 1/4 of people in jail met the threshold for serious psychological distress, and more than a third have been told by a mental health professional that they have a mental illness. One explanation for these findings is the use of police and the criminal justice system as a response to mental health crisis. Police are often involved in responding to mental health emergencies, which can result in incarceration and, in many instances, the use of force when mental health professionals would have been better suited to address the situation. Although African Americans are more likely to be involved in the criminal justice system, once incarcerated, if they have not been previously diagnosed with a mental illness, they are even less likely than other groups to receive a mental health evaluation. And when they self report a mental illness, they are less likely to receive treatment. Evidence indicates that the mental health screening tools used in jails reproduce racial disparities, resulting in fewer African Americans screening positive for mental health conditions and being referred to services to address their mental health needs. Once released, formerly incarcerated people are nearly 10 times more likely to be homeless, which can significantly worsen mental health conditions. To disrupt the cycle of mentally ill individuals being jailed and released without adequate mental health support, the task force recommends that the legislature enact legislation to implement and fund the following programs and protocols. First, to reduce calls to 911, which increases law enforcement involvement in behavioral health emergencies. The task force recommends that the legislature enact legislation to fund a media campaign to increase awareness within African American communities of 988 as a non-law enforcement emergency call-in option for those experiencing mental health emergencies or crisis. To decrease arrest rates and increase the opportunity for appropriate mental health services being provided to individuals who are experiencing behavioral health emergencies, the task force recommends that the legislature enact legislation to require and fund the establishment of police mental health collaboration PMHC programs at law enforcement agencies throughout California. PMHCs are collaborative partnerships among law enforcement, mental health providers, and often CBOs. PMHCs are designed to allow law enforcement to safely respond to behavioral health emergencies and have been shown to be effective in diverting individuals to appropriate mental health settings instead of jails without a concomitant increase in other harms. Key features of effective PMHC programs include training for law enforcement officers on recognizing signs and symptoms of mental illness, education to increase officer awareness of mental health resources within their community and collaboration with those resources, and training for officers in de-escalation techniques. The task force recommends that the legislature require training for law enforcement officers that include these elements and also require local law enforcement agencies to engage in routine evaluation and reporting of findings to determine effectiveness and to make program improvements. And on that note, I will end the reading of Chapter 20, Part 2 of the California Task Force report. Before you go, if you haven't done so already, don't forget to like this video, hit that bell for reminders, and subscribe to our YouTube channel. And also when you go, don't forget to get connected. Follow CJEC on our social media. That includes Instagram, TikTok, Facebook, and X, formerly known as Twitter, as CJEC Official. Get informed. Visit cjec-official.org and sign up for current and accurate California reparations news and info on our Get Involved page. Lastly, get involved. Support our work by volunteering and or donating. To donate, just click the donate tab on the home page of our website. Again, special thanks to our amazing fiscal sponsor, the California Black Women's Health Project, and to the volunteer readings of the California Task Force Reparations Report. I thank you all so much for your time. I appreciate you all. I'm going to let you get back to your day, your night. Just remember, we are closer to reparations than we've ever been in California. And on that note, have a great night.